James Thomas, Morning Blitz Midwest. We're going to talk a little bit about innovative method to treat post-operative inflammation after cataract surgery. And my guest today is Dr. Eric Donnefield. Good morning, Dr. Eric Donnefield.
Good morning, James. Thanks for having me.
Well, thank you for being with us. So, what can you tell us about the future landscape of post-operative treatment of inflation? I can't even get it right. It's this morning. I haven't had my coffee yet. Inflammation in the eye.
It's a tough one. I agree. James, cataract surgery is the most common operation performed in the United States. There are 4 million patients a year who have it done. And one of the biggest burdens is actually taking their eye drops. It may sound like a small problem, but the biggest problem I deal with is patients not getting their eye drops at the conclusion of surgery. And if you do a perfect operation, which is really exciting and fulfilling, and you help bring back people's vision, and they don't get the eye drops, they can have complications that can ruin the operation. So there's a big unmet need for a better way of patients getting their medicines.
What are some of the biggest challenges in post-surgical patient care?
Well, I'll bet that you've had family members who've had cataract surgery. Sometimes these patients are elderly. They can't take the medication because they don't have the manual dexterity. They may have arthritis. They may have other diseases. Sometimes patients just forget to take their medications. And when they don't take the medications, bad things happen. So it would be wonderful to have a better delivery system where patients didn't have to worry so much about taking their anti-inflammatory medicines.
Now, what do these new methods of drug delivery mean for patients?
Well, there's only one FDA-approved medication that's available today that is placed inside the eye that removes the need for using a medicine. That's called Dexecue. And what it does is it is a basically small drop placed inside the eye by the surgeon at the conclusion of surgery. The patient doesn't even know they've gotten it. It sits in the eye and it releases the medicine in a sustained way over about 3 weeks, and it eliminates the need for the patient to take that medicine because it's been given to them automatically by the surgeon who places it inside the eye. So it eliminates the burden of taking the drops. They don't have to worry about forgetting about it, and they don't have to go to the store and buy the drop because it's given to them at the time of surgery.
You talk about innovation in medicine. That is really, really interesting. Where did this idea come from?
I agree. Well, we've been working on this for a number of years, but the company iPoint has innovated this drug, and it's went through the FDA trials. It takes years for that to happen, and it's finally been approved. So it means it's gone through the entire FDA process of being found to be safe and effective.
You know, they talk about innovation in the startup community as far as tech is concerned. We need to start looking more and more at medicine, don't you think?
Well, I couldn't agree with you more, but you know something, there's a lot of great innovation taking place in the United States today in a lot of different areas, not just in ophthalmology, but in all areas of medicine. It's really exciting what we can do today, and drug delivery is among the most exciting areas today in medicine.
Now, where can we go for more information?
Well, if your viewers want to learn more about Dexecue, just go to the website. It's Dexecue, DEXYCU.com, and you'll get the full prescribing information that you need to know about this medicine. You can ask your doctors about it and see if it's available to them. Just got approved by the FDA, so it's brand new, but it'll be available all over the country over the next few months.
Sounds great. Dr. Eric Donnefield, thank you so much for joining us on Morning Blend, and wow, that's pretty interesting.
Thanks for having me, James. Appreciate it.